This is Chapter 16, Cholinergic Agonists and Antagonists. And I talked a little bit about that in the other slideshow where I showed the pictures. So cholinergic agonists, now we have to go to the other side. Instead of the sympathetic nervous system, now we're on the parasympathetic nervous system. So these are drugs that stimulate the peripheral nervous system or the parasympathetic. And it mainly works with the neurotransmitter called acetylcholine. So cholinergic receptors, there's two of them. They are muscarinic. That actually affects the smooth muscles. Think of your bladder, and it slows the heart rate. There's also nicotinic receptors that work with skeletal muscles, but we're not going to talk about that, so you don't need to know about that. So there's two types of cholinergic agonists, there's direct and indirect. Direct means it acts on the receptors to activate the tissue response. Okay, and then there's indirect acting. It works with this cholinesterase, that's what it is. Inhibits the action of the cholinesterase. Just understand that there's two types. You don't have to memorize, but just know that cholinergic receptors, we have muscarinic receptors. There's two. There's nicotinic, but know the muscarinic receptors, and it works with acetylcholine. That's really important to know. These are some mnemonics. Some people learn well with mnemonics. So think of cholinergic drugs, wet, and anticholinergics, dry. So anticholinergics, can't pee, can't see, can't spit, can't shit. So mad as a hatter, red as a beet, dry as a bone, hot as a hair. So dry, they make you really dried out. And the cholinergics causes sludge. So salivation, lacrimation, that's tears, urination, diarrhea, GI upset, and throwing up. So let's wet versus dry. So the effects of cholinergic agents, what it does is decreases the heart rate, it dilates your blood vessels, it increases peristalsis, it contracts the bladder, it increases salivation. So think of it as contracting, you're going to urinate more, you're going to have diarrhea. It constricts your bronchioles, so then you're going to increase with secretions. So this is basically just another thing what we talked about on the last slide, etc. Okay, so I'm not going to go through these pictures. I just want you to understand that there's two different kinds, direct acting and indirect. But cholinergic agonists, the ones that work primarily with the muscarinic receptors, they're in your heart, your GI, the GU glands. So for example, somebody that has issues with diabetes, let's just say someone's diabetic. If someone's diabetic, you can actually have nerve issues with your stomach because remember diabetes, the blood sugar affects every part of your body and the nervous system also. So in the stomach, your nerves may not be working as well. So then we give this Reglan so we can help your stomach digest the food and work better. It's very similar to having reflux symptoms, although it's not reflux. It's called gastroparesis. Pilocarpine is used for eyes, and bethanyl chloride is used for bladder stuff. So we use a lot of stuff for bladder. We know what side effects are, but I want you to know a lot about the bethanyl. Blurred vision, meiosis, hypotension, bradycardia, sweating. Remember, all of this increased stuff. Nausea, vomiting, diarrhea. Remember, it's wet, not dry. So you're always going to get a baseline vitals. You're going to get a health history. You want to make sure they don't have asthma, peptic ulcers, urinary obstructions. And so these could be a couple of your nursing diagnoses. And patient will have increased bladder tone, could be part of your planning because it's used for bladder. You're going to monitor blood pressure and heart rate because now you know what the effects are of the drug. You have to teach them to rise slowly from lying to avoid dizziness and orthostatic hypotension because it can affect your blood pressure. You're going to watch their breathing and make sure it's not causing any issues with congestion, because remember, it makes wet. And monitor them for overdose, which would be very much increased salivation, muscular weakness. This is one that is really not used too much anymore. So what this, actually, I can't say that. It's still used, but it's only used in myasthenia gravis, which is one of those uncommon diseases. And it can dry you up. So they use neostigmine, pyridostigmine to help produce tears, to help produce saliva, and that kind of thing. So that's what these are. There's some side effects which you guys can read here. So irreversible cholinesterase inhibitors, it's used to produce pupillary constriction, potent agents due to long-lasting effects. So again, they're not really used that often. These are not on your test. You really need to know about the bethanycol. And you definitely need to learn about anticholinergics. So they work with the acetylcholine, which I'm not going to go over this because I think this is a confusing picture. So anticholinergics, remember, it's dry. So instead of slowing your heart rate, though, it can increase your heart rate. Okay, and it dilates your bronchioles. And now you have trouble peeing because everything's so dry. It relaxes your bladder muscle, increases sphincter constriction. So it's really hard to get urine out sometimes. Your pupils dilate, decrease your accommodation, so you may have some issues with blurred vision also. Decreases your salivation and perspiration, and decreases your tremors and rigidity of muscles. So that's why it's used for Parkinson's, because with Parkinson's you have a lot of tremors. All right, so anticholinergics, one is atropine. It's used to dry you up. So atropine's used for like any GI procedures to help dry you up before they go down or up with the tube to take a look at your colon and your esophagus. Don't give it with glaucoma because that can make it worse. Also, it's used for, say, people that have trachs, had a stroke, they're not really responding anymore to you, and they're producing so much saliva. You can give atropine to help dry things up so they won't be so uncomfortable. You always want to monitor vital signs, urine output, bowel sounds, safety, because remember it can cause dizziness, provide mouth care, eye drops, avoid hot environments. And so basically what these do, it just has a reaction with the sun. So you just have to be careful with that. And these are used for Parkinson's disease. So these are select anticholinergic that work with the tremors. Benztropine, piperidine, trihexylphenyl hydrochloride. Those are a mouthful. But what it does is decreases the involuntary movement, tremors, and muscle rigidity. Side effects are fast heart rate, headache, blurred vision, the same thing. Anticholinergics, same thing, dry. And again, you're going to monitor their urinary output, get their drug history, the nursing diagnosis, urinary retention related to atropine. Remember, it's drying you up, so you want to watch for all of that stuff. Doesn't mean everybody's going to have those side effects, but it is a potential because it dries you up. Patient secretions will be decreased before surgery, and assess their bowel sounds. I'm not going to read all of this because I know that you guys understand that part of it. Motion sickness, it can be also used for that. So scopolamine, which goes behind your ear and you take it off every 3 days, it helps with motion sickness. So if you're going on a cruise ship or if you get boat sick or car sick, sometimes it's used for that. But again, it can have the same side effects, dry mouth, tachycardia, just not feeling well, although people seem to tolerate the scopolamine patch very well. All right, and that's it.